movements that is possible in the hip. Supposing the right hip is the pathological one to be examined. So there are three planes of the movement. One plane is adduction, abduction, it is in this plane. Another is flexion, extension, it is this plane. And yet another is the rotation, which is along the longitudinal axis of the femur itself. So that all the three has to be recorded, and it should be recorded in active and passive both and compared with the other side. We will be doing adduction and abduction of the right hip. Same will be done on the left side as well. So let us see the active abduction. So one finger thumb I am putting at the ASIS and one finger over the iliac crest, so that I will know when the hip is moving, when the hip is moving and when the pelvis has started the movement. So see this, if you don't be careful, what will happen? Hip is fully, there is a full movement of abduction of the hip, and now if I push it, see this, it is moving now. Can you see this movement? Now this pelvis is being tilted. We have to be very much sure that we are not taking into account of the pelvic tilt. It should be always movement at the hip. Okay, so this putting the fingers over the pelvis is very important for us to know that whatever movement we are seeing is only at the hip. So active abduction I am doing now. Okay, can you? Okay, so easy for us to take it like this. Now I know it is the active movement. So one limb where it was, another where it is now, and it is 0 to 45 degree. And then I will push it a little and see, yeah, little is coming, and then I will again repeat it. So it is 0 to 50 degrees. So active abduction is 0 to 45 degree and passive abduction is 0 to 50 degree in the right hip. We can take it on the left side also. Active extension. Always try to feel for the pelvic movement. So can you make it up, 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 up? So don't allow it to hyperextend or tilt. Pelvis should not be tilted, and then you will be measuring it. So it is easy to make. So one is longitudinal line, straight, and one is to the, so it is 0 to 15 degree. So active extension is 0 to 15 degree, and active extension is 0 to 15 degree and passive extension is passive extension is 0 to 20 degree. Hip and knee flex 90 degree, and then ask the patient to do the rotation. Can you do like this? And then you can measure it very nicely. Here stabilization is not a problem. So this is the position where it was, and then this is the position where it is now, longitudinal axis of the tibia, and it is 0 to 45 degree is the active external rotation, and then a little more, and it is now okay, and it is now 0 to 50 degree, the passive external rotations. So the active internal rotation of the right hip is 0 to 35 degree, and passive internal rotation of the right hip is 0 to 45 degree.